And we're live. Hello, it's Bill, the Knee Pain Guru, and welcome to this week's episode of Ask Dr. Beck. Welcome, Dr. Beck.
Thank you, Bill. Welcome, everyone.
How are things?
Frosty here.
Frosty.
Frosty. Oh, we got like tons of rain yesterday, more rain than we've had since the whole time we've been on the property. And then it turned to sleet, then it turned to freezing rain. And so it's a little winter icy wonderland outside.
Yeah, what happened to the 18 inches you were supposed to get last week?
All melted.
You got 18 inches?
We got 16 or 17 inches, yeah.
And it all melted.
Oh, yeah, seriously. Like our office is a lake now. The office itself is an island in the middle of the lake, but there's lots of water around it.
Huh. No windows yet?
Oh, no windows yet. Nope.
Okay.
Pigs are not flying.
Yeah.
I keep looking at the sky.
Okay. Well, hopefully the lake will dry and windows will arrive.
Yep. I had to go out yesterday and use the tractor to shovel some gravel and make basically a little spit of land in the middle of the water around the building so that we could just get in.
Jeez. Oh my gosh. Okay, let me see. We're going to talk about partial knee replacements today.
Okay.
And prescribed medication. Question here is from Frank. Frank says, I had a partial knee replacement and took very little of the pain medication prescribed to me. I ended up back in the hospital due to a blood pressure spike, 213 over 113. This is a big issue and a natural body response to pain that can't get relief. I recommend taking the prescribed amount to avoid this life-threatening response. Not exactly a question. Yep. However, Frank seems to know something about something. Would you like to chime in?
Of course. Of course. So what I tell my patients, and this is so important for people to understand because Western medicine seems to miss the bigger picture. Mm-hmm. Our bodies were hardwired over 1 million years ago. So we basically, as animals, have a sympathetic nervous system. That's our gas pedal. Fight, flight, or freeze. And a parasympathetic nervous system, that's our brake pedal, rest and digest. Mm. In a perfect world, I'm going to use a car analogy. We live our lives at idle. No foot on the gas, no foot on the brakes. We're coasting along at 10 or 15 miles an hour. Plenty of time to look around, see the scenery, and not go off the road. Mm. Then something starts to chase us, and what we do is we push on the gas. Now, because we're going faster, we have to focus on just where we're driving. Mm-hmm. Life is like this as well. When our bodies have the sympathetic nervous system activated or the gas pressed on, these things that have been hardwired into us over a long period of time happen. So we are effectively running away from saber-toothed cat. Mm-hmm. So what happens in our body is the pupils dilate to let in more, you can see where you're going. Mm-hmm. Hearing becomes more acute. Mm-hmm. Our respiratory rate increases. We want to move more air to get more oxygen to our tissues. Our heart rate increases. Our blood pressure increases. Again, mm-hmm. This is to get the system working at optimal so we can run away from saber-toothed cat.
Right.
The blood goes away from our skin and into the large muscles. The blood also goes away from our digestive system and into the large muscles, the heart, lung, and brain, so that we can see and get away from the thing that's chasing us, okay? Mm-hmm. Again, this is all hardwired. It's somebody who'd been meditating for many, many, many years may be able to alter it, but the body is still trying to drive this response because it's what kept us alive, okay? The immune system initially ramps up. It basically says, hey, if I step on a stick or something like that, running away from saber-toothed cat, I don't want to die. So I'm going to need the immune system at optimal. If the sympathetic nervous system stays on for a long period of time, the immune system eventually starts to crash. So if you've been stressed for a long period of time, you wind up getting sick a lot.
Mhm.
It, again, is how we're hardwired. Now, that being said, everyone responds to this situation of standing there, having saber-toothed cat behind you and growl. Everyone responds differently. If you go through military training, what we try to do over time is basically, can you still hear me?
Yes.
Okay, back. Okay, great. So in military training, what they try to do is train that response to function at a minimum so that you can still think when you're in this high stress situation. And some people, well, everyone has a different response to pain. So if my pain level is, my threshold is very high, okay, and again, I'm going to make up an analogy here. Let's say you take a burning match and you hold it to my finger, and I can sit there until the match goes out. My skin's burned, but my body's not having a response. Very, very high pain threshold versus someone who you get the match 2 inches away from their hand and they can feel it, and their body says, oh, this is bad. So now we're going to bring all that back around into our knee replacement and the necessity of pain medication. If your pain threshold is high and you've had surgery and you can move around and it's not a big deal for you, then you're going to take minimal pain medication. If you are on the other end of the spectrum and your pain threshold is low and you experience a lot of pain, you take more pain medication and you'll take it for longer and potentially even stronger pain medication than someone with a high pain threshold.
Mhm.
Now, all of that goes into the experience of having an increased blood pressure. Increased blood pressure is a response to stress. So if your mental state is pretty rested and you don't feel like the surgery is tweaking your body and you don't feel pain, you probably don't need the pain medication. If again, you're at the other end of the spectrum, feel like you're going to die from it, pain medication is a good thing.
Mm-hmm. That sounds good. I mean, it's a real simple understand. Simple, yet it's profound because you're connecting the dots as to
Yes.
why
Yes.
your body or why the body or why Frank's body is responding to what he's dealing with.
Absolutely. And now that we've got Frank's question out of the way, I'll add just a little bit to that.
Mm-hmm.
So that sympathetic nervous system, its response is to fight, run away, or completely freeze. And basically like fall to the ground, play dead. Think that way.
Like possum.
Exactly. If we take that response from, let's say 500 years ago, before there was a United States, and we were theoretically, if you were here in this country, living a more primitive life. Running away was normal. Fighting was normal. Freezing, maybe only if it was an overwhelming response. And so that was the response of the time. And so when we look at where we are today, running away is often frowned upon. I get students, people that are in school, whatever the grade is,
Mm-hmm.
they come and say, I'm having anxiety attacks. And so I have to frame it this way. Well, if you are in class, you can't leave class. You can't run away without permission. Otherwise, you get in trouble. You can't fight without going to the principal's office or getting expelled from school or whatever it is. Those two avenues are then closed to your body's response to stress. Now all you get to do is freeze. And if you're playing possum and someone sees you, your body's response is to freak out.
Mm-hmm.
Oh my goodness, none of my defenses worked. Your body then subconsciously says, I'm quite sure I'm going to die. And you have a panic attack, for which Western medicine says, we can medicate you, but they don't fix the underlying problem.
What a conundrum we're in as a society.
Yes.
Any, well, for those that may be listening to this podcast and experiencing panic attacks or that type of scenario, is there anything you can suggest or steps they could begin taking to address these larger patterns that are going on?
Yes, indeed. So we might call it a brain hack. What happens is when we are non-stressed, we as human beings function on a higher level. So most animals, if we follow our progression, you can have in humans a human state. You're not stressed. You walk into a room, you look around, subconsciously your body goes, okay, there's the door, there's a second door, there's a couple of windows, people are 10 feet away from me, there's no stress. I'm not in an immediate threat. That's if you're human. If you've been stressed, we regress, we go backwards along our embryologic lines. So we go down the evolutionary chain and we become animals. So think cheetah, tiger, doesn't matter, raccoon, doesn't matter, whole thing.
Right.
Fight or freeze. If we get more triggered, we tend to become a lizard, like a chameleon. And literally we try to blend into the paint in the wall, and maybe no one will see me if I don't move my eyes and I don't breathe and all this kind of stuff. And if we get the most triggered, we literally revert to worm state. You become catatonic. These people who, and no matter what you say, that's the response. Their body on the outside has shut down. On the inside, it's trying to still run away. Okay? That is how we respond. And again, this is all programmed into us. It's hardwired. It's very, very hard to change in a meaningful way. Because even if you've gone through military training, if the response is overwhelming enough, your body still reverts back to its original programming. Okay, so the thing to do is, if you are in a situation, I'm going to make it optimal first, a situation where someone around you that you know and trust, they basically are the bodyguard for your body so that you can have your little freak out and you know nothing is going to be able to come close to you. This is wonderful if you are in a committed relationship with someone that is a strong committed relationship and you feel like you can trust the other person. Okay. And it is by far the easiest one to set up. You look at your partner and you say, hey, if I start breathing really fast, if I grip your hand, whatever the signal is, I just need you to make sure I'm safe, touch me, make sure that my body knows nothing's wrong. And now we'll go down the list a little bit. If you are alone, what you try to do is think your way back into safety. When you get triggered, typically you stop thinking. And so the first thing that you want to do is control your breathing. And one of the ways you can do that is you can square breathe. So this is all about counting in your head. You breathe in for, let's say, a count of 3. You hold for a count of 3. You breathe out for a count of 3. You hold for a count of 3, and you breathe back in. That number can be made up. It could be 10 if you are able to do that. But very quickly, in 4 or 5 breaths, all of a sudden you notice your nervous system is starting to relax and you start to think again. Another way of doing that is you simply go to your checklist and you check in. You look down, you go, still got 10 fingers, still got 2 feet. They're in my shoes, but haven't felt my toes fall off. Knees are still there. Hips are still there. Legs work.
Yeah.
And so what you're doing is you're telling your body that it's still ready to be able to act if necessary. I can still run away. I can do all these things. But at the moment, I am not in immediate danger.
Mm-hmm.
Gives you then the ability to come back from that animal state into the human and thinking state, and you work your way back out of the panic attack. Okay. Those are like brain hacks. Now, there are also body hacks that I would say, and I'm not giving you an exhaustive list, but these are the things that I have used. Bach flower remedies tend to work really well with the emotions. And rescue remedy, if you're prone to panic attacks, is a very good one to have in your pocket or your purse. The moment you feel a panic attack, 1 or 2 sprays or dropperfuls of rescue remedy on the tongue or under the tongue, and all of a sudden the volume is turned down on whatever's going on. It doesn't make it go away, but it makes it less intense, and you are able to then come back to thinking rationally more quickly.
I'm making some in the show notes.
Yep, perfect.
Yes.
There are essential oils that work for people. There are homeopathics that work for people. And basically, it's an exploration to figure out what will work for you through just a little bit of trial and error. And if you know someone who has been through this before, anxiety, panic attacks, and they can help guide you, it makes your trial and error period shorter.
Sure. Yeah. Okay. Got that in there. Okay. Well, let's do a little promo thing for the Comella Foundation here. I'll play this right now, and then we'll come back and wrap things up.
Perfect.
Our mission at the Comella Foundation is to relieve pain naturally using osteopathic healing principles. The Comella Foundation is recognized as a nonprofit 501c3 under the Internal Revenue Code. Your contributions are greatly appreciated. Please consider taking a moment and donating to the Comella Foundation to help us continue our important pain relieving work. Every little bit helps.
And we're back. Okay. That was a question for today. And, the addition I think you brought was very valuable regarding how to deal with the fight, flight, or freeze response, the stress that comes, daily life, whether real or imagined, and some real valuable techniques on addressing that. So thank you very much.
Yeah, absolutely.
Cool. Okay. Well, our next one, what do we got? Our next one's going to be Friday, the 25th of February. Our next Ask Dr. Beck episode. For those that are watching this video, please give it a thumbs up, like, and subscribe to the Comella Foundation YouTube channel. Turn on notifications for future videos as we do these once a week. You can also submit your questions here to ComellaFoundation.org ask-dr-beck. So you can check that out there. And that's what we got. Anything else you want to say before we wrap it up?
Don't slip on the ice.
Yeah. Be careful in these crazy times.
Exactly.
And be complicit with the tech guys.
For sure.
Yeah. Awesome. Okay. Dr. Beck,
Cool.
thank you so much for being here.
Thanks,
Have a
Bill.
wonderful day. We'll see everybody next time.
Take care, everyone. Have a good week.